Hello, welcome back. The topic today is sleep apnea and its effects on our body. So what is sleep apnea? We all know we need the importance of sleep. We need at least 7 to 8 hours of good sleep, good quality and quantity of sleep. What is sleep apnea? So sleep apnea is nothing but you stop breathing temporarily during the sleep. So that's called sleep apnea. So when you stop breathing, see the oxygen level goes down, the carbon dioxide level goes up. So when the carbon dioxide level goes up, your body, your brain becomes alert and it disturbs your sleep and it makes you awake. This is called sleep apnea. Okay, there are two types: central type and obstructive type. The central type is nothing but there is no reason, no obvious reason, but we have a respiratory center in the brain. When during sleep, the brain stops the signal. Even during sleep, the brain gives signal to sleep. When the signal stops, the breathing stops. When the carbon dioxide level goes up, the brain gets alert and again sends a signal and you start breathing. So this is called central sleep apnea. There will be no obvious reason to say you have a secondary reasons to say that you have a sleep apnea. The contrary is the obstructive type. Obstructive type, there is a reason. Suppose somebody is obese. So obese people, they put fat on the aerodigestive tract, so the air entry goes down, so the snoring becomes more. Or even obese people have a thick tongue, so when they sleep, the tongue falls back, obstructing the air entry. Or the children, especially tonsil adenoids, they have an insect, so that can obstruct their breathing. Or somebody has a septal deviation or polyp in the nasal part, so these can, short neck people, all these people have a reason to say they have a sleep apnea. Okay, how do we know that somebody has a sleep apnea, or when to suspect that I have a sleep apnea? First is that sleeping duration, the quantity and quality of sleep comes down. That's the first thing. Second thing, mostly the partners, they will say, he snores a lot. Most of the time the partners, the person snores a lot, disturbing others' sleep, such a loud snoring. Or they keep rolling or keep moving, they keep on moving in the bed, restless sleep. So why? During the body, the brain itself makes them to move, roll, so that in one position the oxygen goes in, so that the carbon dioxide level comes down. Even the carbon dioxide level goes up, they keep agitated kind of state. So these are the third thing. They started using from one pillow to two pillows, three pillows. They raise their head level, or even they raise their head of the cot. So these are automatically they try to do that. And the very important the signs is daytime sleep. Daytime sleep is the first and foremost thing. If you have, then you have to check whether you have a sleep apnea or not. Why do people sleep in the daytime? So usually, as I told you, obese people, tongue falls, and because of the weight, obese, when they lie flat, the abdomen gives pressure, the diaphragm is elevated, so the capacity of the lung comes down, and already no air is going in, so carbon dioxide level, oxygen level goes down. But in sitting posture, the stomach pulls it down, the gravity pulls it down, so the diaphragm moves down, the lung expands, the more oxygen more air entry can be made and oxygen can rise. And the tongue fall also will come, there is no tongue fall in a sitting position. So they sleep easily, they fall asleep very easily in the sitting posture, the daytime. So that's why people, when they are reading newspaper, they fall asleep, or the office, they fall asleep. Watching a movie, the movie theater, they fall asleep. Or even driving, there's the worst thing during a car drive, or they easily fall asleep. So these are the signs and symptoms. They can, you have to think about sleep apnea. Even there's something called micro sleep. What is that? Without your control, they sleep for 1 minute, 2 minutes in the daytime. Without their control, they'll be awake, they'll know everything, but they'll be going to sleep. These are the signs and symptoms. If you have, we have to suspect. Even children, they can have sleep apnea. Again, they will be irritated, they will be agitated, aggressive behavior. Number one. Number two, they also sleep in the afternoon. Usually children, up to 18 years, they don't sleep that much in the daytime, especially their toddlers, they will sleep. But school-going children sleeping in the afternoon or the daytime, the aggressive behavior, the studies, these are when affected. Then we have to think about sleep apnea, like tonsil, adenoids, and all those things. Okay. How to diagnose it? Of course, the doctor, when you go to the doctor, he'll ask the history. Then he may ask for some tests like sleep study, even CT scan, the brain, a pulmonary function test, blood test, especially ABG. Arterial blood gas analyzes where your oxygen level, the blood level, oxygen is low, carbon dioxide is more. These things can point out you have a sleep apnea. Central type, there is only one option. You have to go for CPAP machine, that is continuous positive airway pressure machines. Even for obese obstructive type, these CPAP machines can be used. Sometimes they may require surgery. And what is a CPAP machine? It forcefully positive air entry, so it forces the air into your lung during sleep. There are now very advanced machines are available. They are very small. You can carry in the pocket. Certain machines and all, they can analyze your the sleep. Even if you're breathing, the machine will stop, and if you stop, if you're not breathing, the machine stops. These kind of advanced machines are all available. So sleep apnea can affect your health. How? First and foremost is, we all know the essence of sleep. 8 hours or 7 hours sleep is a must. If you don't sleep, first and foremost to be affected is your mental health. You'll be irritated, you'll be frustrated, you'll be depressed. So you keep shouting at others, so the relationship can get, even office or in the home, the relationship can be affected. So mental health. The second thing is your performance. Suppose somebody is working in a office or in a factory, their performance will come down. So 80% or 20% production, the performance can happen. So third, it can affect your body. How? Of course, as I said, it can affect, first and foremost, sleep is very important for our immunity. So if you don't sleep, your immunity goes down. The body repairs, or only during sleep your body repairs. Only during sleep your acid level is low. Your heart, brain, kidney, everything takes rest. The rejuvenation or the cleansing of the liver, everything happens in the night. So if you don't sleep, nothing happens. So the wear and tear of the body increases. And the other thing is hormones. The first and foremost hormone I would say is about insulin. Insulin, if you don't sleep properly, the insulin resistance happens. So diabetes, if suppose you don't have any diabetes, with the sleep apnea, diabetes can happen very early, or somebody already has a diabetes, the sugar will not come to a control at all. They gain weight, sugar will not under control at all. So insulin resistance can happen. The other thing is your growth hormone. People think growth hormone is only for growing children. No, even if you are 100 years old, growth hormone is very needed every day. It builds up your muscles, even hair growth, everything depends on your growth hormone. So the growth hormone is affected. The hunger hormone, ghrelin, and your fullness hormone, leptin, all these are affected. Because of that, you gain weight. So sleep apnea, suppose you have a daytime sleep, daytime micro sleep, or you snore a lot, and your partner complains about your sleep, and you wake up frequently for the urine. These are all signs and symptoms could be signs and symptoms of sleep apnea. And get the proper help from the doctor and treat yourself. Thank you.